AGFA Healthcare develop e-health and imaging systems to deliver essentially better patient care for hospitals or healthcare organisations. So we help them deliver better patient care. In terms of AGFA Healthcare's products, when I say we had e-health and imaging products, we have about four different product areas. So we've got integrated care, we have imaging IT, which is like radiology and imaging data within hospitals and managing that. We have imaging systems, that's your x-ray machines. We actually manufacture the x-ray machines. And they have like EHR, which is like electronic patient records around hospitals. So we have all four different product areas. So they all add value in slightly different ways. But for example, the integrated care product, which is what we're showing and talking about today, the benefit of that is connecting up care between, in the example we're giving, is cross-regional, so between the Republic of Ireland and Northern Ireland. So the patient doesn't have to travel 7 hours for a round trip for chemotherapy. They can go 40 minutes down the road somewhere near the house by using our systems to connect up and have imaging data and patient data available to all those who need it. As an organisation, the NHS is big. There's a lot of complexities there. Funding is always, is key as well. I think the opportunities there and the innovation to connect it up, an enormous. And we're seeing that with a lot of our customers in the UK, working together as consortiums and collaboratives to share information. So the key thing is sharing information. We've all seen the frustrations when we've gone to the GPs and we're waiting for patient data and we haven't got that. We haven't got the relevant results, or they're not there available. It's that connecting up to provide those who need to have access, the relevant access, and also in real time as well. So there's no, and the example in Ireland is making sure that actually the specialist clinicians knew that was real-time data. So that was the latest information they had on the patient, which can affect the decisions they had. And the benefit for them is they're more efficient. They can do their tasks more efficiently. Benefit the patient is they can get, seen and dealt with in the most appropriate way, that's more personal to them as well. That's either nearer to them or it can be around their lifestyle and whatever, those types of things. I think we're seeing, the shift from, like I said before, connecting up information systems. They could be different of information systems, but starting to share that and have access on the kind of platforms that we expect and use every day in our everyday lives. We do technology now that's available on iPads, and the information is also available on phones and those types of things. And you can do quite powerful information and tools within that environment. So that's enabling clinicians to be connected up and do their work, not necessarily tied to a desk in a hospital, but if they need to do look at a report or look at information and they're actually at home or they're out in the field or wherever they are, they can acknowledge that. So then that speed of information comes, so it's about really integrating systems, bringing them together, and then if you go further, you think about the technology and the advancements of predictive and analytics and those types of things. So you've got all this information and then you're running analytics on it. So you've got automated alerts that could potentially give clinicians, that better support mechanism or the ability to use the tools that we like, WebEx type tools that we use. So actually, I need a second opinion on this. I can see my colleagues online. I can just ping him and give him access to that and say, what do you think about this? So that whole collaboration that we used to in everyday life for a lot of other technologies, we can start, and we actually start and deliver in healthcare. I think events like this are important from, as a head of marketing in AGFA. Sometimes getting to the right people is always a challenge, or getting to be able to network and share the messages that you do with the right people is always a challenge. So to get a kind of high-level C-suite audience to come through, and understanding what their roles are and what they're looking for in these type of events, and be able to share the actual work and projects that we're doing, because sometimes it's a challenge to share those information to those key people. So certainly by coming into a smaller environment with a good agenda, with appropriate information, that means you can start having those discussions actually, you know, from a commercial side, organisation side of things, to try and look at opportunities for projects and new business and those types of things.